COVID-19 has thrown innumerable challenges in front of the world. The world is grappling with it. But we also have stories of hope, resilience, and courage. Namaste, you're watching New India Junction. I am Nivedita Tiwari. We are going to share one such story of hope today. We have with us Mr. Anil Hebbar, who has volunteered for the COVID vaccine trials in India. Anilji, welcome to New India Junction. Why don't you tell us a bit about your background? What is it that you do, and how did this start?
Well, I'm an electronics engineer by education. I started a small company in 2000. I work in the field of medical equipment and training doctors, and that's my main line of activity. But apart from this, I've been active as a social worker since 1987. I was involved with Baba Amte, the well-known social reformer. I was part of his Knit India cycle tour, where we cycled from Arunachal Pradesh, Itanagar to Oka in Gujarat, which was a total of 5,800 kilometers, trying to learn the problems that the country was facing and trying to think of solutions that we as youth could offer. So this was my sort of training in social work, and after that there was no looking back. I have continuously offered my voluntary services to half a dozen charitable trusts who are working with people. And one of the trusts I've been active with is called Helping Hands Charitable Trust. So till COVID, we were active whenever there was a Nepal earthquake. We sent a team to Nepal and participated in the relief work. During the Kerala floods also we were there. So now when COVID started, Maharashtra went in for a lockdown on 15th of March. And first 1 or 2 days I was at home and got bored quickly. But then my friends who are working in the slums in Mumbai came to me and said that there's going to be a lot of trouble if there is a total lockdown, because the people in the slums are all mostly daily wage earners, and they go to their places of work using local trains. So if trains are not going to work, then they won't be able to go work and they won't be able to earn. And most of them have their families back in UP or Bihar or Jharkhand and places like that. And then they can't send money there. So their families also will be in trouble. So we need to do something for these people, about 800 to 1,000 families. So that was the request my friend Bilal Khan, who works in the slums of Mumbai, made to me. And then we drew up a plan quickly to how to raise resources for this. And we decided to go on Keto for a fundraising. And then we started with initially a modest budget of about 10 lakh rupees, and we started. And then we were not too sure of how people's response would be and whether they would support the people living in the slums. But I should say that the people of Mumbai were magnanimous, and our fundraiser took off with a bang right from day one. We started collecting almost 1 lakh of rupees every day, and we started. Our initial target was to supply dry ration kits to about 800 to 1,000 families. But I should say that today we have supplied dry ration kits to more than 20,000 families, and we have cooked 1.3 million meals in the 6 community kitchens that we were running. So this is in short what we did. But then there are so many other things we'll talk during the course of the program.
Sure. No, I think you should talk to us about this started in March, and then sort of a chain of help was created and people started coming together to do this. How much did social media help in this?
Social media helped a great lot. In fact, all our fundraising has only happened because of social media. Being small individuals doing little work, of course, you can't even hope to get the attention of national media, but social media has been the savior for us, and everything that has happened because of social media. Now, if I enumerate what all we have done, it will be about 25 different things. So we started with the supply of dry ration kits. Then we somewhere realized that many people are so poor that they can't even afford the kerosene or the gas to cook their own meals, even if you give them ration. And many of them were homeless. So we started community kitchens in 6 different localities in Mumbai. More than 13,000 people were being fed every evening in our community kitchens. And then when the lockdown happened suddenly on March 25th, there were many people visiting Mumbai who were stranded here and there. There were homeless. Mumbai has almost 35,000 plus homeless. And all these people were stranded. and what to do. So we tied up with the Home Guards and Civil Defense of Maharashtra. They had a big ground at Warsaw at Andheri, and we started a camp for the homeless and the migrants who were stranded here and there. So we about 300 people came to our camp. This started in early April and went on till 5th of July. We finally wound up the camp on 5th of July, and more than 300 people were there in our camp. So we took care of their the food and their medical help whenever required. And we're happy to say that in those 100 plus days, not a single person in our camp had COVID, even though the surrounding flats and high rises had a lot of COVID cases. In our camp, which had out of 300, about 35 were homeless people, beggars. The remaining were migrant workers who were stranded and travelers to Mumbai. In fact, there was one person from Spain who was traveling through Mumbai and got stranded. He was in our camp for a few days, and then we got in touch with his consulate and sent him back to Spain. So we did it was a pretty interesting job, and we're happy to say that finally on the 16th of July, every single person who was in our camp reached their homes, including 6 of them who were deaf and dumb or mentally challenged, who did not even know the name of the address of their houses. They didn't have any phone numbers with them. But we did a lot of jasusi, found out where they are from with sign language. On social media, we guessed which state they were from. Some of them we left in Howrah, one of them was from Nepal, one was from Benares, one was from Valsad in Gujarat. So like that, we have left them all in different places in India in a taxi. And the others went home by flight, by bus, by train, and the special trains which were there. So we sent all of them home. And then there are so many people in different parts of the city who had to go for the dialysis procedures, for cancer treatment, but there were no trains, no buses. So we were running our cars like a shuttle, taking them to their treatment, bringing them back. And there were people stranded in different railway stations, so including students who were coming back from their hostel in Kerala. So we brought them back to their homes. So like that, we were a sort of anything you call us and we are there. And we should realize that those days we didn't have passes with us. The police were very strict, but still we somehow managed to do all this. It just happened.
Yeah, no, I mean, truly helping hands, the kind of stories that you hear of people helping, the stories are incredible. But obviously it is one thing to help people, and that definitely comes from a space of empathy. People need to feel for others. But in a situation like a pandemic, when your own you would say safety is at risk, your own health is at risk, how did you think of volunteering for the COVID vaccine trial? Like, where did that come from? Weren't you scared?
See, for 6 months I've been every day from 10 a.m. to 10 p.m. I'm on the streets. I eat in people's houses. I have tea everywhere. Only thing is I take certain basic precautions, like I always had my cloth mask on. I don't take too many people in my car. I don't go to like crowded places. Like if I won't take an elevator, I will go up the stairs. Things like that. So I managed to keep free of COVID. Nobody in my team. Initially, it all started with me, Bilal, and Lara, 3 of us in the team. But now we have more than 150 people actively helping us in our work across the country. Now we have gone beyond Maharashtra. We have got teams in Tripura, in Bihar, in Assam, people everywhere in Uttar Pradesh helping us out in our work. So Helping Hands is now a sort of all India organization. We are in Haryana, we are in Delhi, we are in Gujarat. So all of us have been basic principles of social distancing and all that we have followed, and none of us have had COVID. Of course, I'm also a believer in homeopathy, and in the early days, I took this camphor 1M and gave it to each one of my team. And we also gave it as part of our ration kits to many family members, and almost all of us, I don't know whether any one of us have become COVID positive. Okay. So I was pretty confident, and during the course of this, I did my own RT-PCR and antibody test thrice, and all the times it came negative, so we were not infected. In fact, it was a little surprising for me also, because when the migrant crisis was going on, when they're all walking back and on going by buses and trains, we were there in our with our Jeevan Raths. We were distributing theplas, dry food, biscuits, footwear for them, water and all. We were in the middle of the group, and there were thousands of people around us. And in spite of this, we didn't have COVID. So I was somewhere very curious to be experimented upon, and I was even willing to, if need be, take a vaccine of the virus. But then, of course, this vaccine is not the virus itself; it's a protein derived from a
Yeah.
gene of the virus. But then somehow I was ready, and what happened is during the pandemic, a lot of our friends have died, our friends' relatives have died. We have been hearing of a death almost every second day. Somebody or the other whom we know, whom we've heard of, has died. So there is a big scare going on across the world, and
Yeah.
somewhere the whole world is waiting with bated breath for the vaccine. And so when I heard that the trial for the vaccine is going on in our own city, I immediately volunteered. I didn't think about the consequences or whatever. So I said, it's my duty to be a part of the trial so that the vaccine comes out fast. That
So
was the
yeah,
intention.
no, I think that's really brave and inspiring. But are you allowed to talk about the process? Like, how were you? Did you approach them, and how did that go about?
I can talk something about it, though not the full thing. Because most of it is maybe on the ICMR website also. So I can tell you some of the things. I was approached by a friend of mine who lives in Pune, and as you know, Serum Institute of India, who are the manufacturers, are also based in Pune, and he probably knew somebody there. And so he called me on the 5th of October saying that there is a trial going on and they needed 100 people, and they'd already given it to about 55 people, but they were falling short of people and they wanted some people to volunteer. So he asked me if I am interested in going and giving my sample, and if I can take somebody else. So immediately I discussed it with a team member, and she was immediately ready to come and take the vaccine along with me. And she in turn got a friend of hers to come, and I spoke to another doctor who's also been part of our COVID work, and he also readily volunteered. So we were four of us on that day, and then after I tweeted about it, more people joined, and within 2 days the 100 was over.
Wow.
And so that's also the power of social media, and of course the media also took it up.
Right.
Once something comes on social media,
Yes.
the media also later latches onto that, and then it came in the national media, and then people went and volunteered. And I'm happy to say that it's all over now. At least the initial 100 is done.
Yeah. While taking a decision such as this, you also have to think about your family, right? Because it's not just about you. How did you convince your family, and what was their reaction when you told them?
But I have not convinced them till today. They're not convinced. But then sometimes you have to take your own decision. I of course mentioned it to my mother, and it didn't sink into her. She was happy that I'm getting a vaccine, and but my wife, of course,
Yeah.
was not too happy with my decision. But then, as I'm a student of science, and uh, people might think it's something heroic and it's great and all that, but I don't think so. It's a vaccine. Finally,
Yeah.
it's not the virus, and I was pretty confident that being with the people for 6 months, and the virus has not been able to do anything to me. So what can the vaccine do? So I was pretty confident in that.
Would you like to tell us more about Helping Hands, the kind of growth it has seen as an organization, and more about the kind of work that it does?
See, after we started our community kitchens, what I did was I took the help of an organization called Gar Bachao Gar Banao Andolan, which works for the rights of the slum dwellers in Mumbai. And Bilal Khan is the person who is leading this organization, and they have a lot of volunteers. So we took the help of their volunteers to run these community kitchens. And then the biggest kitchen we started was in Bhiwandi, where 6 lakh people working in power looms were thrown out of jobs, and there was absolute hunger there in Bhiwandi. So we started a massive kitchen using the union members of the mills itself. So they were about 150 people. They would start cooking at 3 o'clock in the afternoon, and by 7 o'clock the meals would be ready, and they would come with their auto rickshaws and motorcycles and take the meals and distribute it to uh, all those households. So 6,000 meals were distributed between 7 o'clock and 8:30 in the night. So all this happened only because of volunteers who We don't have a single salaried employee in the trust. We're all volunteers, and our administrative expenses are close to zero, except a little bit of petrol and things like that. There are no administrative expenses, and whatever donations come goes for directly for this work. And then what happened was Bihar. There was a big flooding, and it was COVID plus floods. So a team of our volunteers who were based in Bihar, they were students of Tata Institute of Social Sciences in Mumbai, volunteered to undertake the work there, and so through them we did it in Katihar and other places. And Guwahati, also there were massive floods this time, and so we decided to work there. In fact, as I'm talking now today, we are distributing ration kits for about 250 families, 50 in Guwahati and 200 in Udalguri in Assam. In the coming week, we are doing 200 families in Tripura, the Tripuri tribal families in Tripura. So we are reaching out to wherever help is needed, subject to availability of funds, of course.
Yeah.
And we are not taken big foundation, some help from Give India for ration for running our community kitchens in Mumbai. Other than that, we haven't taken too much help from large foundations. It's mostly been through small donations on keto and things like that. And we have had more than 5,000 so far.
Hmm. Hmm. How has the help from the administration?
As I told you, I never even tried to apply for a pass because I knew how difficult it is. But to the credit of the police, they never tried to hamper my work. Because when they so many times they caught me and then show me this paper, show me that paper. When I explained to them, see, this is the work I'm doing, and I even showed them my dicky. You see the ration kits and PP kits and N95 masks that we're giving away. So they very willingly let me go. So there was no problem. And Bombay Municipal Corporation also, to the extent possible, they helped us. Otherwise, we were not too dependent on the administration, frankly. Our money was coming from private sources. We used to get SOS calls from call centers set up by many NGOs, and then so the administration never really came in, except for the phase when we were transporting migrants back to their towns. That was when we had to interact with the district collector, with the railway authorities, with all of them, with the police, and most of the time people were helpful.
One final question. What would you like to say to the young audience watching this show?
When I was with Baba Amte, he always used to tell me that youth is he whose vision walks afoot with him. Whose vision walks afoot with him. And youth is he who never looks at life through the sheltered bars of tomorrow. So I like to give these two messages to the youth. And see, there's no point in worrying about something which you don't know. Most of the people tell me, oh, you took the vaccine, tomorrow this might happen, that might happen. Well, that's an unknown. I won't allow my today to be spoiled by my fear of tomorrow. So we will handle tomorrow when it comes. Today you do your best. That's my message to everybody.
Anilji, thank you so much for the incredible work and the selfless service that you're doing. It is an inspiration. Thank you for joining us on New India Junction. It was a pleasure talking to you. Namaste.